Dr. Chaves, let's talk root canals. You know, the old, like, everything in life which goes bad, really bad, that's more so as bad as a root canal.
Yes.
Yet my last root canal, it was nothing else but boring.
Yeah.
Yes, it was boring, a little uncomfortable keeping the mouth open for a while, but rather than that, there was nothing to it. It was no worse than my cleaning. So what's the deal about root canals?
You know, root canals have really gotten a bad rap.
Yeah.
But they kind of deserved it, because in the past, root canals was actually kind of a torturous procedure.
Why is that?
They used to involve as many as 5 visits of an hour each time.
Yeah, that's torturous.
And if you think about that, that's almost cruel and unusual punishment, I think.
Yeah.
You know, so that's how it used to be. Today, a root canal, by and large, in the United States, is done within an hour, and it's a one-visit affair. You're in, you're out, straightforward. There should be zero pain from start to finish. Unless you have a lot of infection, then maybe it'll take a little longer to get you completely numb, and your dentist may have to augment his anesthetic technique, maybe not only give you a block, but give you some local and do some variations to really profoundly get your tooth completely numb. It really depends on how much pus you have, but by and large, it's a straightforward affair, very simple. You're in, you're out, and you're done. And so the days of the scary root canals are really over.
Now, what can one do to perhaps avoid a root canal in the first place? Is there something we can do?
Yeah.
Or is it just, look, it happens, there's nothing you can do?
Yes. Go see your dentist regularly. Don't get cavities.
I see. So cavity develops, a bigger thing, goes down, gets the root infected, and then that's it.
Yes. There's basically two reasons why we have root canals. The main reason, of course, is caries formation. You develop a cavity, the cavity goes down to the nerve becomes infected, the nerve dies, turns to pus, necrosis. Or sometimes it's through trauma, just actual drilling on your tooth. If you have a deep filling, if you have a cavity that's close to your nerve, does not expose your nerve, but it's close to your nerve, your dentist comes in there and he removes all the decay. It's all gone. There's no more decay in your tooth. But he's sitting 0.5 millimeter from your nerve, and he does his filling, and he does his little dance, and he does a little prayer, and wishes you the best. And then 2 weeks later, you come back and says, "Doc, my tooth didn't hurt me before I met you. Now it's killing me." This does happen, and that's because of inflammation. The decay in your tooth was so close to your nerve that the actual procedure of trying to fix it probably sped up the death process of your nerve, and that's because of inflammation. And then you still have to do a root canal in that case. But by and large, just keep your teeth in good repair. Go regularly to the dentist. If he tells you you've got a cavity, don't wait another year or 6 months to address it immediately, so that it's not a deeper cavity. It's not closer to your nerve.
I see, and you see, I can see that I would have the tendency of going, is it small? Yeah, it's very small. Okay, so I'll do it whenever,
Right.
In fact, as far as I remember, I just got a teeth cleaning in Switzerland because I travel sometimes, and so anyway, there I had some time, and I knew I was overdue. And the guy said, he says, "You have a little cavity there." I'm not so sure he even said 2. I said, "Well, are they big?" No, he says never. So I kind of like, oh, fine. Next one and saying, but what you're now saying is, well, that little cavity becomes big. Yes, it can still be fixed. Number one, becomes more invasive. The tooth could break easier because there's a bigger whatever.
Sure.
However, it comes closer to that nerve, which then could get easier infected.
Exactly. Exactly. And sometimes it may not even get to the nerve, but because it's close to the nerve, your dentist, in his attempt to save you from that cavity, ends up causing trauma and inflammation to the nerve, and then the nerve checks out.
Right. And that's not even his fault anymore at that point. It's just, different nerves will react.
You just waited too long.
You waited too long. Now, what's the story about after a root canal, one needs a crown? I mean, we're talking money here. Is that just for you guys to extract more money from us?
Yeah. I certainly can see how patients could look at that and think of it that way. But in the United States and around the world, it's standard procedure that once you've had a root canal on a load-bearing tooth, and that's defined as a molar or a bicuspid,
something you chew on, I guess.
Yes, teeth that take load. They once you've had a root canal, they become brittle. They're weaker. They have a hole right through the tooth, okay, and the tooth itself becomes devitalized, so it becomes weaker. So it's more brittle. So if you do not put, think of a crown almost as like a helmet. Putting a helmet over your tooth, okay, that's protecting your tooth from occlusal forces, because we're able to put many pounds per square inch of force on dentition, and we do it day in, day out.
Yes.
You know, just remember the mouth is a perpetually wet environment.
Yeah.
That is filled with saliva, which slightly salty. Okay, okay, and we're continuously pounding everything in there.
Right.
Okay, and then we put sugars in there, and we put all these acids and all these different things. You really need to. Your teeth do an amazing job, and if they have a root canal, they become weakened. So you really need to put a crown on the tooth.
Got
Yeah.
it. So, and if you miss it, even though it might hold a few years, it might for all purpose hold forever, but it might also break rather soon. And once it does break, you of course got a even more severe situation. Now you need to probably take it out and now put a bridge in it, a root canal, an implant or something like that.
Sure.
So you basically, just like with a car, you know, if it's just an oil change or a new belt, that's great, you know, fine and not convenient, but doing it, not doing it, might cause you the casket to blow.
Yeah. Yes. Not doing it increases the risk that you're going to lose your tooth.
Well, very informative. Thank you very much.
Thank you.